This is a short video on PEP, which is a respiratory intervention known as positive expiratory pressure. This is a mask that you put over your face. It comes with a manometer, it shows you the pressures, and it's in centimetres of water that you're blowing out to. It also attaches to this, which is the inspiratory and expiratory valve. The air comes in through here and blows out through there. Now these little green things on the end, you can get different colours with different widths. And these are how we change the pressure used in the PEP. And it all fits together like so. And then a patient would blow through it and to a certain pressure for a certain amount of time. So PEP, it involves breathing out against the resistance, and this is thought to open up airways by forcing air through collateral airways, aiding sputum clearance from distal airways centrally, and it can help to counteract airway closure caused by bronchomalacia. PEP mainly works by increasing pressures within the lungs by limiting the amount of air being exhaled. Valves, these ones, are used to cause increased resistance during the exhalation phase, making the breath out active. The back pressure that is generated forces air through collateral airways, and it allows the air to get behind a sputum plug, which may have been blocking a certain airway. The increased pressure of the expiration also creates a shearing force and detaches sputum from the walls of the airways, moving it more centrally to areas where it can be cleared more easily by mucociliary function, or by coughing, or by a technique known as the forced expiratory technique, also known as a huff. So when would you use PEP? You'd use PEP with any appropriate respiratory patients with secretion retention that is not being cleared independently or effectively. So it's commonly used with bronchiectasis and cystic fibrosis patients. There are other indications for use with post-op atelectasis, providing there's not a significant oxygen requirement or a significant increased work of breathing. And caution must be taken when using this equipment with patients who are at risk of fatigue due just to the increased expiratory effort that's needed to breathe out against the resistance that the valve is causing. And always check the contraindications before you give any patient this respiratory treatment. In terms of making the PEP as a treatment harder or easier for a patient, you can get different diameter valves. This brown one here is a wide diameter valve, and the other one is quite a small diameter valve. The less diameter of the valve, so a small diameter valve, it makes it easier for a patient to meet a certain pressure on the manometer because of the high resistance to expiratory flow that this creates. It creates a large back pressure in the lungs, and what this does is the patient doesn't have to produce as much effort to get to 10 centimetres, between 10 and 20 centimetres of pressure on the manometer, whereas using a wide diameter valve, the patient has to produce a lot more respiratory effort and have a lot more expiratory flow to reach the same 10 to 20 centimetres of water on the manometer pressure when breathing out. So what we're going to go through now is just one cycle of a PEP treatment that you do with a patient. I'm going to do it with Lizzie. So I've already explained to them about what PEP is, why they're going to be doing it. We've found out which valve is fine for their use, and we told them that they want to be aiming between 10 and 20 on this manometer and holding the breath out for 6 seconds. And then we're going to do 6 lots of these 6 out breaths, and that they should be actively exhaling but only very slightly, and it shouldn't be too fatiguing or too forceful. So Lizzie, if you want to put that onto your face, and then when you're ready, just take a nice deep breath out. 1, 2, 3, 4, 5, 6. And again. 2, 3, 4, 5, 6. Okay, and then just. So what we do is we repeat that for 6 breaths, After a set of 6 breaths, we'd encourage the patient to use the forced expiratory technique. Side effects for this adjunct, they do include dizziness and lightheadedness if the patient's not taking adequate rest time in between, also if they're breathing out too hard or they're taking 2 deep breaths in. So make sure a patient has at least a few normal breaths between each cycle and between going straight from using a PEP to doing the huff, then the cough. Make sure they have a few normal breaths in between going back into another cycle. Inappropriate technique and a poorly fitting mask are side effects that you should be looking out for, otherwise the technique's not going to be effective. The masks can also cause skin irritation occasionally, especially if you're using them daily. So sometimes for people who have sort of rubber allergies or latex allergies, the mouthpiece is a lot better. Also, this equipment really needs to be maintained. It needs to be washed after every use and sterilised weekly. If it's not, it has the potential for causing chest infections, because not only are you breathing out through it, you normally leave it on your face and breathe back in through it. So it's really, really important that you need to make sure that any patients you see with a PEP, they're maintaining the cleaning on it. And then contraindications wise, a patient with frank hemoptysis you wouldn't want to treat with PEP, or a patient with active TB because of the risk of infection for yourself also.